Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Today I want to talk to you about starting hormone therapy and getting into the rabbit hole of chasing numbers. This is something that I see people do, especially on social media such as Facebook, all of the time. And here's why you don't want to do this, and this is why you want to avoid this. So what do I mean when I say chasing numbers? You're starting hormone regimen therapy, and then you go on a Facebook group or you start talking to people on a Facebook, and you get into this conversation with somebody about what are your numbers, how much are you taking, how frequently is your dose, what route of administration, and what are your current numbers, what are your blood work says. And then you start this comparing game, and then somebody else chimes in and says, oh, no, you're taking too low or too high, and everybody starts, before you know it, playing a doctor. Now, I understand why people do this. That's because as a community, we're all trying to help each other and we're all trying to inform one another, especially when there's very few endocrinologists that are knowledgeable in transgender care. So of course, it's understandable that you will seek information from somebody that has been transitioning for a while, find out what has been really working for them. And it's only understandable that you would like to talk to them and find out what those have they've been taken to see the results they have achieved. But keep in mind, one of the things people forget is that our bodies are drastically different. And not only does it matter on what type of anatomy and physiology that you have, but also it matters drastically on what your age is, if you have any medical conditions, and most importantly, how your body metabolizes hormone. Whether you are on testosterone or whether you're on estradiol, it doesn't matter. It all matters how your body is going to metabolize it. So for somebody else, a particular dose, your body will metabolize differently than somebody else with exact same dose. This is why it's imperative never to ever chase numbers. What you want to, if you want to chase anything, chase how you feel. Chase the results you're seeing. Chase seeing if you are getting the physical changes within a reasonable time period, and if you're seeing the changes that you really want to see. Are they coming through? Chase also your moods, your emotional state. How do you feel on a particular dose? That's what you really want to do. You want to find something that works only for you and not for anybody else, and you want to kind of wipe out anybody else's numbers. You want to create your own numbers that work only for you. In other words, customize hormone regimen for yourself. Don't mirror or mimic or model somebody else's customization. That's their customization. That is not for you because you are not them. There's no way it's going to work for you. It may work sometimes, it may work for some period of times, but in the long term, you gotta find what works for you. And the best way to do it is talk to your doctor periodically. If you have an endocrinologist or a doctor that prescribes hormones and they're not very trans knowledgeable, you need to advocate for yourself. This is very imperative. And that means every 3 months when you go for your blood work, and hopefully you are doing your blood work because that's really important, you want to ask your doctor, let's go over my numbers. Can you tell me what these numbers mean? Can you tell me what these numbers mean? Within 3 months, this is how I felt. Should I feel a little bit differently? Should we do something about my dose? So you want to have that conversation with your doctor also about the changes you're seeing or not seeing. And advocacy in health field is incredibly important, but you want to find something that works for you. You don't want to take matters into your own hands. It can be very dangerous. It can be very unhealthy. So stop chasing numbers and start customizing your hormone regimen for yourself based on how you feel and based on the changes you see. So hopefully this is helpful. Comment below, let me know how you approach your HRT. If you ever started chasing somebody else's numbers, what was the result of that? Did it backfire? Did it work for you? Sometimes it does work for people, but again, that is not reason enough to take matters into your own hands. So the best thing again is to customize things for yourself because no two people are alike. Everybody is drastically different and a lot of things going into the hormone regimen other than just, a standard dosage and a standard frequency of administration. A lot of things go into it. Your age, as I said, your health, just your physical aspects of your body, how your body tends to work, how your body tends to metabolize hormone. So comment below, let me know, and I'll see you guys all next Friday. Or, well, this is not Friday anymore, so I don't release videos on Fridays anymore. I guess I'll see you guys next Thursday. Bye.